Hello everyone. In this video, I will explain to you the theoretical steps for drawing blood for ABG. So whenever somebody asks you how to take an ABG, you can tell them these steps. So the first step would be to extend the wrist. The wrist of the patient has to be extended and palpate the radial artery. Before drawing blood, perform Allen's test, which I will explain a little later in this video. Allen's test is performed to check the blood flow to the hand. Now, what we will do is, with this syringe that we are using, we will rinse it with heparin. We will fill it with 0.1 ml heparin and we will flush it out. Remember, you don't have to take heparin in the syringe and keep it and then draw blood in it. What you have to do is take heparin in the syringe and then flush it out. This is called rinsing it with heparin. And finally, you pierce the artery at a 45-degree angle from the horizontal. Allen's test is a test that is done to check if the ulnar blood flow is intact and the ulnar artery is patent or not. See, what happens is, during an ABG, we will pierce the radial artery and we will take blood from that artery. So, when the radial artery is pierced, you have to make sure that the ulnar artery is patent so that the hand keeps getting its blood supply because the radial artery has been pierced. If the ulnar artery is not patent, then you will not perform an ABG in that hand or from that radial artery because the hand might lose its blood supply. So to perform Allen's test, the steps are, first of all, you occlude both radial and ulnar arteries on that hand. So whatever hand you're taking the test on, you occlude both radial as well as ulnar arteries on that hand, and you will see there is some blanching because the blood supply to the hand stops. Now when you release the ulnar artery while still occluding the radial artery, you can have two outcomes. First of all, the hand might regain its color. The color comes back, which tells us that the ulnar blood flow is normal because the radial artery is still occluded, but the ulnar artery has now been released. So the hand is getting a good blood supply from the ulnar artery, which tells us that the ulnar blood flow is normal and test is positive. That is, Allen's test is positive. Whereas, if the hand still remains blanched, it tells us that the ulnar blood flow is not patent, artery is not patent, and that means the test is negative. So an ABG should not be taken from that hand.